Hi everyone, welcome back to another episode of DxTx. I'm your host Sahan Ansafi, and in this week's episode we're going to be talking about how to know if you may be pregnant. Before we jump into this week's topic, as always, I really appreciate your support, and always please remember to like, comment, and subscribe below. So please take a moment and do that. I would really appreciate it. Over the last few episodes, we've talked a lot about COVID. I wanted to bring it back a little bit more and talk about some of the other concerns that we've been seeing over the last year. In particular, a lot of people have been at home, not a lot of things to do, so people have been getting busy, family planning, and I actually personally in my line of work in the emergency department have seen lots of issues and concerns related to pregnancies. So in particular, when we talk about pregnancies, one of my biggest pet peeves is really, if you just think that you're pregnant, that shouldn't really be a reason for you to come to an emergency department. Believe it or not, there's lots of people who I've seen who literally are coming in just for a pregnancy test alone. And I would say that there's lots of other options available, which we'll talk about in this video in terms of where to go or how to figure out whether or not you could be pregnant. But before we get to that, we're going to actually talk about what are some of the signs and symptoms of pregnancy? What are the easiest ways that you can find out whether or not you may be pregnant? Unfortunately, when it comes to pregnancy, there's lots of different presentations. People's bodies work in different ways, and there's lots of women who may not really have any symptoms of being pregnant, while others may early on in their pregnancy exhibit lots of various symptoms that could indicate or be indicative of pregnancy. Common things being common, a lot of women might notice that they're more fatigued. You may start to notice that there's some breast tenderness, so if your breasts are getting sore, you're feeling more fatigued and out of it than usual, you may be pregnant, and it may be worthwhile for you to do a pregnancy test. Other common symptoms include nausea, morning sickness, waking up in the morning, feeling nauseous, sometimes associated with vomiting as well, that may be unexplained by another cause. That may again indicate that you could be pregnant. And the last, but certainly not the least, and really the most important symptom when it comes to pregnancy is a missed period. Now, the big thing with missed periods is a lot of women may actually have irregular periods, so it's important to realize that just because you missed your period, it does not mean that you're pregnant. However, if you've missed your period, you're sexually active, even if you've used some sort of contraceptives, remember the contraceptives are not perfect, one of the things that you should consider is a potential pregnancy. And what I always recommend for women who are concerned is to compare your periods to what your baseline may be. So if you're somebody who has very irregular cycles, your normal might be a 5 to 6 week cycle, but that's just always how it's been. And now you're at week 9, week 10, week 11, and you still have no signs of menses. In those cases, for sure, I would recommend getting a pregnancy test. So always ask yourself, what's your normal, and are you veering away from that normal? If you are and you're sexually active, there is a risk that you could be pregnant. One of the other things that we see a lot of is women will say, well, no, I use condoms or I use contraceptives, I can't be pregnant, that's impossible. So it's not impossible, and there are certain situations where contraceptives don't work 100%. Again, if you've missed a pill, if, for example, your barrier contraceptive was not used correctly or was defective, there is a chance that you could get pregnant as well. So keep that in mind. The other thing I hear a lot about in the emergency department is women will oftentimes say that they did have some vaginal bleeding, which they thought was around the time of their period. So again, I got my period, there's no way that I could be pregnant. Sometimes what we actually see is that the bleeding that you've noticed, if it wasn't in any way different from your normal periods, oftentimes lighter, maybe just more spotting than anything else, that could actually mean that you may have had what we call an implantation bleed, and may actually just be a result of your pregnancy alone. So bleeding doesn't always mean that you may not be pregnant. There's lots of other reasons why you might have a little bit of vaginal spotting or vaginal bleeding, so keep that in mind as well. At the end of the day, the most important thing for you guys to know is if you have any concerns that you may be pregnant, the only way to know is to complete a pregnancy test. There are two main ways that a pregnancy test can get completed. The most accurate way is a blood test called a quantitative beta HCG. So in cases that are a little bit more obscure, or in the emergency department when we're concerned about complications of pregnancy, we will complete this blood test. But as a screening test, and a very accurate test as well, are the urine beta HCG tests. Now, a lot of people are worried that the urine pregnancy tests are not very accurate. However, it's important to realize that actually by the time that you get to the point where you have missed your last menstrual period and you realize that there is a potential that you could be pregnant, most tests are actually quite good at picking up that beta HCG level. And so what I would recommend is wait a couple of days at least until after that first period before you do your first pregnancy test. Make sure that you do it in the morning when your urine is concentrated and not diluted. So you don't want to drink a ton of water before you do this, because again, that may sometimes alter the results. And then sometimes I recommend keeping a couple of pregnancy tests. So if you're really worried, do that first test a couple days after when you're concerned, but wait a week or 2 weeks. And if there's no signs of your menses beginning or occurring in that situation, then repeat that test. Obviously, there are scenarios where unfortunately you may be unable to acquire pregnancy tests. Sometimes the ones in pharmacies, especially the brand name tests, can be quite pricey. In those situations, even dollar stores carry urine pregnancy tests that are a fraction of the cost of a lot of those brand name tests and function very, very effectively as well. If that is still not an option for you, then what I would recommend is seeing a walk-in clinic or a family physician, your primary care provider, to discuss your concerns and have them complete a test on your behalf. Really, in the cases where obviously you're concerned or excited that you could be pregnant and you want to know as soon as possible, it is not ideal or a good use of resources to come to the emergency room only to complete a pregnancy test. If you're otherwise well and you're just concerned that you could be pregnant, there's lots of other options available. Again, as I mentioned, pharmacies to purchase urine pregnancy tests, or following up with a primary care provider in a family practice or in a walk-in clinic to discuss your concerns. So that wraps it up. Very straightforward episode. Hopefully that was valuable to you. And as always, please remember to like, comment, and subscribe below. I look forward to hearing your thoughts, and I wish you all the best. Stay safe.